You're listening to
CRST,
the podcast
from Bryn Mawr Communications.
Hello, everybody. Welcome back to another episode of a special four-part series focusing on differentiating your cataract and refractive laser surgery practice. I'm Detlev Breyer from Breyer Augenklinik in Premium Eyes in Düsseldorf, and I'll be your host for today. The first two episodes in this series focus on pearls for planning cataract and refractive surgery and delivering a great experience for patients during surgery. Today, we'll uncover how lenticule extraction can play a role in differentiating your practice and learn more about the advantages and limitations of the procedure. I'm excited to moderate this podcast and discuss our subject with experienced high-volume pioneering world-class surgeons. They are Maja Bohac from Svetlost Eye Clinic in Croatia, Bruce Rivers from NU Eye Laser Center in Maryland, and last but not least, Pavel Stodulka from Gemini Augenlaser in Czech Republic. So let's get started. Topic number one is a personal experience with lenticule extraction. So let's go around and have everyone share their level of experience with lenticule extraction. My first question is, how long have you been performing the procedure? So we start with ladies first, Maya, then Bruce, and then Pavel, please.
Hello to everyone. I started back in 2013, first with Smile, and then we worked our way through to Smart Sight from the Schwind company. So for the last 2 years, we are basically working on the new laser platform.
Then it's Bruce's turn.
So I started Smile in the U.S. military. I was one of the first surgeons in the military to do Smile when it first came to the U.S. Back around 2017-16. So I've been doing it for about 5 years.
And Pavel?
I've been doing Smile for about 10 years. I started a little later than I should have because I was quite commonly the first surgeon in the country or in the region with the new technologies. But I thought, this new surgery Smile is something really nice and something which might, take over. But all the technical people from all the laser companies I asked, they said, well, don't do it. It will never, ever gain the precision. This technology is nowhere. It's no way. So I started a little later, and where we are today, it's I think the best technology, and it takes over, and it's very, very significant in laser refractive surgery. So I'm very happy to be a Smile surgeon, and I also work not only on Zeiss platform, but we also use the CMAT platform as well.
So interesting what you said, Pavel. I also started 13 years ago, so one of the first 5 in the world. But I remember the first sessions at ESCS or ESCROS meetings and being there in the last room, in the last corner, and 5 or 10 people listening to what we said. And that really exploded. So today, where does lenticule extraction fit into your refractive offerings, Maya?
It's considered like premium refractive surgery with the highest price and the highest patient demand. So it brought us publicity because we were the first clinic to do lenticules in Croatia and in the region. And now we are one of the first in the world and first in the Europe that started with Smart Sight. So it gives us some positive marketing, I would say. And we are getting quite a few of people for the last many years who are afraid of LASIK flap and don't want to bother with the pain after surface ablation. So at this point of time, due to the studies for Schwind company, lenticule is around 20 to 25% of our market share with the corneal refractive surgery. But I think when we stop recording everything, it's going to go up to 70 or 80%. I still think that LASIK and PRK have their place in refractive surgery, and there are some benefits of those two for some patients, but today majority of the patient can go for the lenticule extraction. And I think the major advantage is because they feel secure.
That brings us to Bruce. He said he started Smile in the military. There are also, I think, very interesting aspects to it.
Yeah, so I'm kind of in a unique situation because in the military, refractive surgery is a really big thing. But in the military, prior to SMILE, PRK was probably the predominant procedure that was done, mostly because a lot of people were worried about LASIK flap issues. Even though in my time in the military, I didn't see a lot of LASIK flap issues, but that was always the concern. So at my center, we were probably doing like 70% PRK, 30% LASIK. When SMILE came out, it totally changed the game for us because I think the way I've always looked at it with SMILE was that it's kind of like the best of both worlds. It's the healing of LASIK, but the stability of PRK because there's no flap. And so that really became popular in the military and specifically at our site. And so I retired from the military about a year and a half ago and decided to open my own practice. And so for me, it was just a natural progression to offer SMILE in my practice. But what's odd is that we're the only ones in the Washington, D.C. metro area offering SMILE. And so, I went from an environment where, people were kind of beating down the doors to get SMILE to now I'm trying to educate people about SMILE because it's not as well known in the Washington, D.C. area right now.
So, dear Pavel, where does lenticule extraction fit into your refractive offerings in Czechoslovakia?
Well, it grows, number one. Number two, we educate our patients about this keyhole surgery, like, the abdominal keyhole surgeries, endoscopic surgeries, it's less invasive and safer. People understand that. And I would like to point out two things. That number one, nowadays we have more lasers from our companies, and SMILE is a company name, so we probably should call this procedure lenticle extraction because that would be covering all the platforms. And it's good for everyone, for the industry, for the patients, and for the surgeons to have the same name. And I would even propose a name LASIK, lenticle extraction, because, well, it has a lot of advantages over LASIK, but at the same time, I think it's not good to blame LASIK like a bad procedure. It creates, a bad situation on the market. So we say, well, we offer the surface ablations, which for certain patients are the best option. We offer LASIK, which is a great procedure, and we have this keyhole procedure, lenticle extraction or SMILE, which has several advantages also, and we pack it all together as great procedures.
Yeah, I can really say everything all of you said fits to our premium eyes refractive surgical center. It's part of our surgery, but it's now a big part. It became up to 70%, but we're still doing LASIK, like for presbyopia correction or hyperopia correction. So it's still LASIK is very important also in our refractive surgery. And we price everything the same. For example, it doesn't mind if it's trans PRK, if it's PRK, if it's LASIK, femto LASIK, or SMILE surgery. We say the competence is in the hand of our surgeons and not in the procedure. So, coming to the next point, how do you educate patients on the procedure, Maja?
Well, I think I have to congratulate Zeiss company this time because a lot of marketing the company itself did in the early beginning of SMILE, actually. And unfortunately, some negative marketing for LASIK regarding LASIK flap, regarding ectasia, regarding complications came on internet. So today we have millennials, and I usually already get educated patients who are seeking the best clinic in the region and seeking the best procedure, which they think is SMILE. There are a few patients where I see a little bit of dry eye, or I see a potential with a better visual quality or visual outcome if I do lenticule than LASIK or PRK. And then we talk about the safer surgery, about the surgery through the small hole, like Dr. Stodulka said, like minimally invasive in comparison to LASIK where you have to cut, or in comparison to PRK where you will have the wound after the surgery. But patients usually come with some kind of idea what types of the surgeries they can get.
Bruce, what about you?
So we kind of present everything to patients, and I talk about the value of all the procedures. I often use myself as an example. So I had PRK 17 years ago. My wife had LASIK, and so I talk about all of the procedures in a positive light because you never know where a patient's going to end up. And so I always want to make sure that they know that they're going to get great vision regardless of what procedure they choose. I will say that for us, our predominant procedure is SMILE. We seem to have two groups. We have a large number of patients that maybe their family members are from Asia or Europe, and they've been told about SMILE, so they come specifically looking for it to us. And then there's the folks that come to us that don't know about SMILE, and because in my talk about refractive surgery, I talk about SMILE, PRK, LASIK, ICLs. They're actually wowed when I show them like the differences in the procedures and the pros and cons. So it really has become like I think a fun thing to kind of talk to patients because there's so much misinformation. And I think when they come in and they hear like not only how many procedures are available, but just the differences in these procedures, I think it really helps them feel comfortable when they choose SMILE.
Pavel, what is your strategy?
Just would like to add a few things because I think you covered very well the topics. To make it very simple for the patients, we say that predominantly we prefer LASIK or PRK for small myopia up to 4.5. Then 4.5 to 8.9, it's typically lenticle extraction SMILE. And over that, it's typically picky lens. So maybe that's something very simple to add to our patients.
I remember also the beginning times, people came in for a LASIK and I offered them SMILE as the safest procedure. And they looked at me like, oh, who am I? And I said, you're patient number 10 and number 11 and number 12. So in those times, it was really hard to convince people and other doctors. But today, due to the internet, people and patients come in very well informed and they really have an idea what they want. And that's what the status quo is today. So let's move to topic 2, clinical advantages and limitations. What are the advantages of lenticle extraction? Let's talk first about the biomechanical advantages, Maja.
Well, literature told us that there is no biomechanical advantage with the lenticule in comparison to LASIK, and I have to admit that I have one late ectasia in SMILE. It happened 7 years after the primary procedure, probably due to the eye rubbing because it's unilateral, and it was on a good cornea with a great pre-op topography, and the patient was only -4 before the surgery. But he reported few months before we noticed ectasia that he had some kind of conjunctivitis that lasted for quite a few weeks and that he was rubbing his eye heavily. So I don't think that we have a biomechanical advantage. I think we have a psychological advantage over our patients and a little bit advantage in the feeling of dry eye, because frankly, when you compare PRK, LASIK, and lenticule, all the patients have dry eye after the surgery. It's just the question how severe the dry eye is. And the patients after lenticules are recovering a little bit easier, and they don't have that gritty feeling for a long time in comparison to LASIK. And of course, they can touch their eyes. I wouldn't say rub their eyes, but they don't have flap, they don't have epithelial healing, and they can live more normally 2 days after the surgery in comparison to any other corneal refractive procedure.
Okay, Maya, so you already covered all 3 subjects, so why not continue with Bruce, also talking about biomechanical advantages, dry eye disease, and no flap complications?
Sure. So, for me, I do feel that there is some advantages to kind of maintaining the anterior stroma. I don't think that you should throw caution to the wind, though. I think that a lot of people maybe think that because you're quote unquote preserving the anterior stroma, that you can kind of do cases that you would otherwise maybe default to surface ablation. And so, coming from the military where we tend to have a more conservative approach, my threshold for pushing someone into the direction of surface ablation is kind of the same. I don't necessarily feel that I can do SMILE on someone that I would have rejected for LASIK. So to me, if they're not a good LASIK candidate, they're typically, in my mind, not a good smile candidate. From a dry eye perspective, I agree with Maya. I think that post-operatively, I think that all patients end up using some drops for lubrication. But I do feel that folks that are maybe mild to moderate dry eye, I do try to push them towards smile, just because I do think there's some advantages there. In terms of the no flap, I mean, that's a huge selling point for anybody, especially someone who's really active. I think where it really hits home, though, is for co-management. I think that any of the optoms that co-manage with me, I think they like the fact that there's less concern of a flap issue and maybe the concern for having to send the patient back to me to refloat the flap if there's an issue. So I think that's been like a great advantage as well.
So, Pavel, would you please be so kind and cover those three subjects as well?
You all started with biomechanics, and there is a puzzling information out there in the literature and on the internet. I still think that we cut less with lenticle extraction compared to LASIK. So I think we preserve more stable cornea. And to compare LASIK and SMILE, I think we would need to compare two different optical zones, because if you cut out the lenticle of 6.5, then the optical zone is significantly larger. So we can, I think, take much smaller lenticle and then compare with LASIK. And then I'm really convinced that biomechanics are in favor of SMILE. And I typically do my SMILE with 160 micron cap, because I try to preserve as much as possible from the anterior stroma. And I also like to combine both LASIK or SMILE with cross-linking. We do the specific cross-linking with limited energy. And I'm really convinced that this also adds to the stability of the cornea post-op. So that's regarding the biomechanical features. A dry eye, I think Maya said it perfectly, that all cornea refractive surgeries, and I would say, well, all eye surgeries can induce dry eye and make it worse. So that's totally true. But there are also some differences. And I think PRK has little less dry eye compared to LASIK, and SMILE has a little less also. So we need to manage dry eye comprehensively, because I think that's the main drawback of laser vision corrections, that people get dry eye and then, despite of 20/20 vision, we are very unhappy. So dry eye is our enemy. And I would like to emphasize that by far our best tool against dry eye is acupuncture. We have developed our own method. Actually, my wife, who is acupuncturist, developed that, and it's really effective. So dry eye, we need to somehow take care of. And the flap complications are quite rare, and usually they are really easily manageable. But with SMILE, we have no flap complications. Of course, there might be arguments that you can have lenticle-related complications, but these are extremely rare. And we, surprisingly, I was at the beginning, afraid that how often I tear the lenticle, I have to fish the part of the lenticle inside of that pocket. It does not really happen. So it's a very, very safe procedure with very low rate of complications.
Yes. So with biomechanics, I would say there are a lot of scientific, theoretical, significant articles that say that SMILE should be better. I stick a little bit to it, as I do most of my cases at 150 micrometer. So the cap is 150 micrometers, because the upper part of the cornea is the most stable part. Then talking about, if you go to the edge at 250 micrometers residual stroma thickness, I usually prefer to use the SMILE Extra protocol from Sri Ganesh. I think that's a very good idea. So, Pavel, I really think that's a good idea. I use it as well. I'm very positive to cross-linking, as I started with Theo Seiler many years ago. And that's why I really do like cross-linking and convinced of the concept. Dry eye disease, I'm a little bit surprised. If you look at the literature, it says all the nerves, they grow together again in SMILE after 1 month, and LASIK takes 3 to 6 months. So I always give artificial drops 2 weeks before surgery. And dry eye in my clinic, I don't know if it's therefore or if it's the climate or whatever, is not really a big issue. Not in Smile at all. And in LASIK, I think there's much in the internet about the dry eye. I don't really feel it, but I give a very extensive artificial eardrop therapy before and after surgery. Coming to flap complications, I didn't have any for 3 years. Then before I came here, I had 3 in 2 weeks, and I was really surprised. I thought, well, what's going on here? I didn't change anything, and I had flap complications the first day with flap folds. One was really with the eye drops, and it really removed. And in the upper part, there stayed a little bit of flap folds, but not in the optical axis. So I'm very happy we do have Smile, and I tell my patients when I market Smile, I say the good thing about Smile in comparison to LASIK is that you sleep well, but I sleep well as well, because I can sleep well because I know you can't rub your eyes, you cannot hurt your cornea. That's why I really love Smile, but I also think that Pavel is right. That you always have to counter argue with lenticule removal and complication during lenticule removal. And even we do have now since February the new Smile Pro, which is really a step ahead again. Nevertheless, some lenticules are a little bit more difficult to remove. That will stay a little bit on the negative side of Smile surgery, that some surgeons really might have problems with it if they are not advanced surgeons. So not anybody of course doing 30, 40, 50,000 more cases. But when you start, then of course LASIK is much easier or PRK than Smile. So the last point is, of course, what about the outcomes if you compare LASIK and PRK and Smile? Maja, what are your data or your emotions about it?
Well, if we talk about emotions, I would say that the lenticule patients are doing the best because they are the most satisfied patients in the clinic. But if we go to see the data, then it of course depends on the platform. Did we use Zeiss or we used Schwind platform? Of course, there is a time gap in between those platforms, so I don't know how comparable they are now because the technology moved forward. But I would say that LASIK is regarding the high order aberrations to some extent is still the best, and then very near LASIK comes lenticule, and with the little worse results with the PRK or surface ablations. But of course, we have to think about the diopter range of the patient. It's not the same if we treat just myopia, then all three are performing the same almost, or we are treating astigmatism, or we are talking about hyperopia, which we still don't have an option with the lenticule. So it depends on the diopter, depends on the platform, depends on the patients. But I would say all three are very near perfect, if perfect exists.
So, Bruce, as I know, the military is really very precise in data communication and documentation. What is your expectation or your experience in outcomes?
Yeah, so my experience has been that the Smile has been great. I always joke about, maybe I was extremely lucky, but this is the third VisuMax I've had, and every one of them, our results have always been great. In fact, we've published in the JCRS journal two articles. One kind of comparing my first year results with Smile, comparing it to LASIK and PRK, and that was when we didn't have the ability to correct for astigmatism. So we made sure we compared apples to apples with the other two procedures, and the results were equivalent. Our LASIK results have always been great, and our Smile results were right up there with LASIK. And then we actually published another article where we looked at military performance before and after Smile. So we sent soldiers to the firing range. We had them do different tasks before Smile, and then we did Smile and had them redo those tasks, and they all performed excellent. So for me, it's always been the results have always been great. I do think there's a learning curve, and so I can see why in some places people might shy from it. But for me, it's always been the results have been great. I know Pavel talked earlier about the lower treating like the lower prescriptions, but I have no problem going down to a -1. Unfortunately in the U.S. we don't have all the bells and whistles that you guys have, so we're kind of restricted in kind of what we can do. But I regularly go down to -1 with Smile. So yeah, I think my results have been great.
So, Pavel, what are your experiences?
Continue what Bruce have said. Yeah, we also perform low myopia correction with Smile, and it works very reliably. Yeah, it is definitely possible. If we compare the three methods, originally some problem with Smile was a lower recovery. It took longer time before they really see well, but recently with all the advances in laser settings, the speed of recovery rivals LASIK. The first day they all see very well, very nice. But having said that, we were surprised. We did some subjective questionnaire questions about the recovery to our patients, and surprisingly, our PRK patients were the most highly satisfied. And we find out why, because we really frightened them. We said that, well, a lot of pain, very long time for recovery, be aware of that. And then they were kind of positively surprised. But with LASIK and Smile, they expect everything all perfect that they want, which is not always there. So that was a big surprise to us. But definitely LASIK and Smile patients recover faster than PRK, even with the latest smart surface, innovations. And there is one group which I would like to mention, which was really also great, and that's a group of hyperopic smiles. I had the fortune to be part of that group, which did the clinical study for size with hyperopic patients. I actually did the most of the cases in the world, and these are great. And they're really, the Smile delivers better results compared to LASIK, at least in my experience.
Yeah, that goes very well with my experiences. I remember 13 years ago, I even had a physicist employed doing all the nomograms. The good thing now, having the new VisuMax 800 in the visualized nomogram, that will be a great tool and help for beginners to be better and improve in smile surgery. And the good thing is that now, first day post-op, most of the patients have a 20/20 vision. So at the beginning, this was not the case. It took through 2, 3, 4 days, but nowadays, especially with the VisuMax 800 and the Smart Pro, it's a really excellent recovery rate because the laser is so fast, you don't even get opaque bubble layers. It's really fascinating. Good. So we go to topic 3, case studies. What patients typically do best with lenticule extraction, Maya?
Depends on the laser platform and I guess time when they were treated. During the VisuMax time, I would say the best patients had myopia around -5, -6. Uh, that was the best post-operative results. But now when we use a different platform, the best results are actually in low myopia. So if you treat -2 or -2.5 or -1.5, tomorrow morning they are better than our LASIK patients with the same refraction. And that's like wow results, because few weeks ago we had a husband and wife had a lenticule and the husband had LASIK, and husband was 2020 and he was very happy, but the lady was 2015 and he was like jealous, because we told the lady that since it's a low myopia, it maybe will take her 2 or 3 days to get the perfect vision. And they came in together and she was reading one line more than him, and he was like, okay. So with advances in technology, I would say that now we have a wide spectrum of diopter that we can treat, and probably 80 or 90% of the patients are seeing 20/20 tomorrow morning. So now some levels of astigmatism are also not a problem, and with new platform, actually some higher astigmatism could be treated. But I guess I'm a lady. I still didn't try to go that high because of the previous experiences. So I'm not as brave as some of my male colleagues, I would say.
So, Bruce, what is your opinion?
Yeah, I kind of agree with Maya. We've had, I think the sweet spot, the patients that are just, everybody's happy, but the folks that seem to be really kind of blown out of the water are the folks that are, like a -3 to and higher. Those folks are just, they're just wowed by how comfortable things are. Their vision's great. Kind of like Maya, I had a husband and wife. The husband was the kind of escort for the wife and was not interested in surgery at all, and he watched her get Smile, and he had watched his sister get LASIK years before. And when he saw Smile, he was like, "Oh wow, I want to get this next week." And so we did his case next week, and he was 2010, and his wife was like, what did you do different? Like, why is his vision so much better than mine? But she was 2015, so it's funny, but he did great, and I think he was like a -6, and she was like a -3, 3.5, and so I think that's like the sweet spot for us.
Pavel, I think we would be also interested. I heard you lastly did a presbyopia correction with SMILE, and you already did hyperopia. So I think you can add some value to the discussion here.
Well, it's early experience, and Zeiss is working hard on these projects, and I think we will have the expansion of indications in the future. But at the moment, definitely, the people who are -8, these are the most excited patients after that, because if you correct someone who is -1 or 2, okay, they are glad, and they don't need glasses for driving or football or whatever, for tennis. But people with -8, they had their psychological problems, they had their cosmetic limitations, they had their professional limitations, and now the day after surgery they come in, no glasses, seeing almost perfect. These are, thrilling stories. And I think we refractive surgeons are kind of spoiled guys. We got used to it. But, I think we should enjoy each of such patient and, share the joy and happiness, because it's great.
That's a very good aspect of everyday life, because when you're a refractive surgeon, you are also criticized very often if the result is not perfect, and it costs you a lot of chair time. But we quickly forget that 95 of the percentage of patients we do with SMILE that would like to embrace us and are happy and are out of their mind. Absolutely. So you're absolutely right, Pavel. We think about, sometimes we lose the idea how wonderful our job is because we always concentrate on the not perfectly done 5%. Okay, so after that little bit philosophical way out, we go back to topic 4, the pointers to differentiate your practice. So patient satisfaction, word of mouth referrals after lenticule extraction, of course, are very outcome. How important are the post-op outcomes in comparison to patient comfort and the visual recovery in comparison to LASIK and PRK, Maya?
Well, I think that's the most important, because if you have happy patients, he will send you maybe 10 more patients for treatment. But if you have unhappy patients, then he will tell that to 100 other persons that you didn't do something well. So having a good postoperative results is like conditio sine qua non. You have to have it, or you have to have it in 95 or 97% of the patients. But also the experience about the surgery is also very important, the story behind the surgery. So if you give your patients a story that they are going to have the best surgery at this point of time in the world, I would say, or the newest one or the safest one, depending how you talk and how you make your market, and they will pay some money for it, and the next laser is like 500 kilometers away, then their need to tell that to their friends and family is higher than if you have LASIK or PRK nowadays, because at least in Europe, the price of LASIK and PRK is much less today than it was in 2008 2008 or 2010, when you had to spend a lot of money to do the surgery and you wanted to tell your friends and your family that you did something for yourself. Now having LASIK or having PRK, it's like normal. So they had something new. They were able to get it in their own country. The doctors were very nice to them. The surgery they didn't have any pain during the surgery. The post-operative recovery was painless. They could see very well tomorrow morning or 2 days after. That's very important for the word of mouth. So they will go happy and they will tell other people how happy they are and how their life changed. So we cannot live without internet marketing and social media anymore. But word of mouth is still probably the most important, because if you have 100 unhappy patients, probably my whole country of 4 million would know something like that.
So that's a disadvantage if you're a small country. But nevertheless, being a small country, I always wonder how many excellent sportsmen you're having in Croatia. It's amazing. Skiing, football, basketball, whatever, 4 millions. it's really crazy. You must be very good at it. You are very good at it. So, Bruce, what is your main feeling if you talk about lenticule extraction that brings patients again to your practice?
So I think that yeah, I feel that it's a differentiator. But of course, it's easy for me to say that because we're the only ones offering Smile right now in the Washington D.C. area. But we have a lot of people that come to us. I've had folks come as far as 3 or 4 hours away to get Smile. I think the problem that we are having in this area is trying to connect, and it's kind of what Pavel said earlier, trying to connect Smile with uh, something that people recognize. And so, we kind of try to use Zeiss Smile interchangeably with flapless LASIK or Smile LASIK or something that kind of ties it together so that patients who are not hearing about Smile from their families in other countries kind of have some kind of framework to put it in. But I definitely feel that as time goes on and it starts to become more popular in this area and there starts to be more word of mouth, that it's really going to take off in this area. It's going to be a huge differentiator.
Well, I think definitely word of mouth is the most important, and we really need it because, as Maya said, one good patient, 10 new patients, one wrong patient, at least 100 away. So that's really very important. And unfortunately, I'm old enough, and being a refractive surgeon for more than quarter of a century, I now get more and more parents, moms and dads, whom I did LASIK 25 years ago, and they come with their 18 years old children and they request a surgery on their kids. So I think that's what we like to hear, or like to do. But of course, you then feel quite old.
Yeah, I made the experience with Smile really boosting my refractive surgery practice. A main fact why people don't have laser surgery is not the price, it's mainly the fear that something might go wrong and the pain. And I mean, with Smile, you can say, I have a 10-second pain free procedure. And from the first day post op, all my patients can do whatever they like to. And for them, it's really an argument. They say, wow, the next day I can go swimming, diving, doing sports. I say, yes, go jogging the same day, do it. So I'm really very positive about this aspect of Smile, and it really boosted my clinical and refractive center. So the last point is about the economical benefits associated with adding lenticule extraction to your offerings. Did it have a positive effect on your practice, Maya?
Yes, it had positive effect. Like you said, number of patients seeking for refractive surgery was declining, and the price wasn't the main reason. There was a fear and negative marketing over the years, and economical crisis and a lot of other stuff that we couldn't have influence on all of them. But re-entering lenticule again in the clinic we got some new patients and some good feeling, I would say, because now we can offer something which is flapless, but it's also painless. Because when we were talking about flapless, we were talking about some amount of pain because we are talking about surface ablations. And like Dr. Stodulka said, we are also telling our patient that it can hurt really, really bad for the first 24 hours. And tomorrow morning, when it doesn't happen, they're happy. But out of 100, there is that one that comes tomorrow morning that he or she cannot live, and that he has some kind of a hat and something over the eyes, and you have parents carrying the patient because he cannot open the eyes. So yes, we needed lenticule just to power refractive surgery again.
Bruce, your personal experience?
We're kind of a unique situation because we opened about a year ago, and we started out offering Smile from the beginning. And so I think it's kind of difficult because we're still kind of building our brand and building our presence. I do feel that it's been great because it's, again, been a differentiator for us. And so we've had people that have specifically come to us because we offer Smile. And so for that, I would definitely say it's been great for us. We actually have a lot of patients, a lot of Asian patients actually, that have found us on Asian social media like Weibo and Redbook because we're one of the few that offer it. So for us, it's been, it was a great decision to start out offering it.
So, Pavel, did you recognize any economical benefits with introducing Smile to your practice?
Well, definitely people understood this is a leading edge high tech technology and surgery. They are willing to pay for that. So you get more inflow of the patient. So that's very good. And I also can't wait for the hyperopic smile to be available because there is a lot of young hyperops out there which are waiting for this surgery.
Looking forward very much as well. And also remembering the first years where I had to invest a lot of money into marketing. I was nearly a little bit desperate how long it took for Smile to become in the common sense of our patients. And now, after 13 years, there are really the big benefits because patients really understood how great Smile is. So it really has um, truly now economical benefits. And I hope all other doctors who start now, they don't have to go to the valley of investment sadness or return of investment when you started many years ago. So that's all we have for today. Thank you very much to our panelists for sharing their experience with lenticule extraction. It was very interesting. I also could learn something. So thank you very much for taking your time and effort. And I think it's clear to all of us that we believe that the procedure can help to differentiate our practices from the next. So stay tuned for the final episode in the series, which will focus on tips to incorporate new technologies into your practice. Thank you very much for listening.